Etodolac is a medication used to relieve pain from various conditions and reduce pain, swelling, and joint stiffness from arthritis. It is known as a nonsteroidal anti-inflammatory drug, NSAID, and works by blocking the body's production of certain natural substances that cause inflammation. If you are treating a chronic condition such as arthritis, it's important to talk to your doctor about non-drug treatments and other medications that can help manage your pain. The recommended daily dosage of Etodolac varies depending on the individual's condition and medical history, so it's important to follow your doctor's instructions. It is typically taken with food or milk to help prevent stomach upset, and the best time to take it may be in the morning or as directed by your healthcare provider. Remember to always consult with your doctor before starting any new medication or changing your current regimen. Before starting Etodolac, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 to 4 times a day with a full glass of water. Remember not to lie down for at least 10 minutes after taking it. If you experience stomach upset, take it with food, milk, or an antacid. The dosage will be based on your medical condition and response to treatment. It's important to take this medication at the lowest effective dose for the shortest possible time to reduce the risk of stomach bleeding and other side effects. Do not increase your dose or use this drug more often than prescribed. For certain conditions like arthritis, it may take up to 2 weeks of regular use to get the full benefit. If you are taking this drug as needed, remember to use it as soon as the first signs of pain occur for the best results. And don't forget to inform your doctor if your condition worsens. Side effects of Etodolac may include upset stomach, nausea, diarrhea, gas, weakness, drowsiness, dizziness, or blurred vision. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. Etodolac may also raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. Be sure to contact your doctor immediately if you experience any serious side effects, such as changes in hearing, mental/mood changes, easy bleeding/bruising, difficulty swallowing, or symptoms of heart failure. In rare cases, Etodolac may cause serious liver disease, so seek medical help right away if you notice symptoms such as persistent nausea/vomiting, loss of appetite, abdominal pain, yellowing of eyes/skin, or dark urine. While a serious allergic reaction to Etodolac is rare, seek immediate medical help if you experience symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Taking Etodolac, a nonsteroidal anti-inflammatory drug, may rarely increase the risk of a heart attack or stroke, especially if taken for a long time. This risk may be higher for older adults or those with heart disease, high blood pressure, or diabetes. It's important to avoid taking this drug right before or after heart bypass surgery. In addition, Etodolac may also rarely cause serious bleeding from the stomach or intestines, especially in older adults. This can occur without warning symptoms. If you experience stomach/abdominal pain, black/tarry stools, vomit that looks like coffee grounds, chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes, stop taking Etodolac immediately and seek medical help. Be sure to discuss the benefits and risks of taking Etodolac with your doctor or pharmacist before starting this medication. Before taking Etodolac, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This medication can cause stomach bleeding and may make you more sensitive to the sun. It can also make you dizzy or drowsy, so it's important to avoid driving or operating machinery until you know how it affects you. If you are pregnant or plan to become pregnant, or if you are breastfeeding, make sure to discuss the risks and benefits of using this medication with your doctor. And before having surgery, be sure to inform your doctor or dentist about all the products you use. Older adults may be at greater risk for certain problems while using this drug, so it's important to use it with caution. If you have kidney problems or are dehydrated, be sure to talk to your doctor about the best way to prevent any issues while taking Etodolac. When taking Etodolac, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Etodolac include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, and water pills, diuretics. It's also important to be cautious when taking Etodolac with other medications that may increase the risk of bleeding, such as antiplatelet drugs, blood thinners, or other NSAIDs. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to Etodolac and may increase the risk of side effects if taken together. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Lastly, Etodolac may interfere with certain lab tests, potentially causing false results. It's important to inform lab personnel and all your doctors that you are taking this medication. If you or someone you know has taken too much Etodolac and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, slow or shallow breathing, and extreme drowsiness. If you suspect an overdose, don't hesitate to seek help right away. Remember, it's important not to share this medication with others. Your doctor may order lab or medical tests while you are using Etodolac to monitor your health. This could include tests for your blood count, liver and kidney function, and blood pressure. Be sure to keep all your medical and lab appointments and talk to your doctor if you have any questions. In addition to taking Etodolac, making lifestyle changes like weight loss if needed and doing strengthening or conditioning exercises may help improve your flexibility and joint function. Be sure to consult your doctor for specific instructions on how to incorporate these changes into your routine. If you are using this medication regularly and happen to miss a dose, take it as soon as you remember. If it is close to the time for your next dose, then just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing Etodolac, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a place that's not the bathroom, and always keep it out of reach of children and pets. If you have any leftover Etodolac that has expired or is no longer needed, don't flush it down the toilet or pour it into a drain unless specifically told to do so. Instead, it's best to properly discard the medication. You can consult with your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.